Healthcare in Worcestershire is now the responsibility of 3 clinical commissioning groups, covering, respectively, Redditch and Bromsgrove, Wyre Forest and South Worcestershire. History. From 1947 to 1974, NHS services in Worcestershire were managed by the Birmingham Regional Hospital Board. In 1974, the boards were abolished and replaced by regional health authorities. Worcestershire still came under the Birmingham RA. Regions were reorganised in 1996 and Worcestershire came under the West Midlands Regional Health Authority. From 1974 there were 2 area health authorities covering the county, Worcester and District, and Hereford and Worcester. There were 3 primary care trusts established in the county in 2002. Redditch and Bromsgrove PCT, South Worcestershire PCT and Wyre Forest PCT. They were managed by the West Mercia Strategic Health Authority, which merged into West Midlands Strategic Health Authority in 2006 when the PCTs were merged into Worcestershire PCT. The closure of the Accident and Emergency Department at Kidderminster Hospital by Worcestershire Health Authority in 2000 spurred Dr. Richard Taylor to stand for Parliament as an independent Kidderminster Hospital and a health concern candidate at the 2001 general election. Taylor campaigned largely on a single issue, that of restoring the Accident and Emergency Department. He was elected with a majority of 18,000, defeating the incumbent Labour MP and junior minister, David Locke. His success, which became known as the Kidderminster Effect, inhibited subsequent hospital reorganisations. Herefordshire and Worcestershire formed a Sustainability and Transformation Plan area in March 2016, with Sarah Dugan, the Chief Executive of Worcestershire Health and Care NHS Trust, as its leader. Commissioning. There are about 570,000 residents in the county, 19% aged over 65, compared with 16% across England. The annual health budget is about £900 million, more than half of which goes to Worcestershire Acute Hospitals NHS Trust. The 3 CCGs announced in March 2016 that they were facing a collective deficit of £25 million. In 2016-17 and were considering restricting access to a range of treatments. The list of treatments under consideration includes physiotherapy for minor injuries, knee and hip replacements, hearing aids for people with mild hearing loss, chiropody not associated with long-term conditions such as diabetes, IVF, gluten-free foods on prescription, over-the-counter medicines for short-term minor conditions, cataract surgery for people with mild vision difficulties, vasectomies and female sterilization, some treatments for patients with unhealthy lifestyles, non-health essential treatments, for example conditions such as excessive sweating and erectile dysfunction, procedures which have limited medical benefit, such as treating hernias and removing tonsils. Hereford and Worcestershire was one of the 4 areas chosen to trial the integration of specialised commissioning, previously run by NHS England centrally. In September 2016, primary care. There are 22 GP practices in Redditch and Bromsgrove Clinical Commissioning Group, 12 in Wyre Forest Clinical Commissioning Group and 32 in South Worcestershire Clinical Commissioning Group. The Care Quality Commission released its Intelligent Monitoring Database, the first stage in the quality monitoring process for primary care, in November 2014. All but 2 practices in the city of Worcester were ranked in Band 6, the highest quality. Peter Pinfield, Chairman Health Watch Worcestershire, said, "By and large I think in Worcestershire we rank very highly. Community care. Palliative care is provided by Acorns Children's Hospice. Mental health. The main provider of NHS mental health services is Worcestershire Health and Care NHS Trust. According to the Trust's clinical director for older adult mental health, Dr. Bernie Coop said, about 8,500 people in Worcestershire, 3.4% of the entire population, are living with dementia, and this figure is increasing by 3% each year. Hospital provision. Hospital provision in the county is by the Worcestershire Acute Hospitals NHS Trust. Psychiatric services come from the Worcestershire Health and Care NHS Trust. More specialist provision comes mostly from hospital services in Birmingham. The Acute Trust runs 3 hospitals in Worcester, Redditch and Kidderminster. Between them, they provide 2 emergency departments, 2 paediatric inpatient units and 2 obstetric departments at Worcester Royal Hospital and Alexandra Hospital. The Trust and the clinical commissioning groups agree that this provision is not sustainable. The Trust faces a funding gap of up to £200 million by 2015-16. There are also concerns about quality and safety because of difficulties recruiting consultants in some specialities. Proposals to reorganize services to concentrate specialities on one site or the other are under consideration, but public consultation was postponed until after the 2015 general election. Worcestershire Acute Hospitals NHS Trust opened a new cancer treatment unit which has 3 linear accelerators in January 2015. A partnership with University Hospitals Coventry and Warwickshire NHS Trust. It hopes to treat about 1,500 patients per year who previously had to travel for radiotherapy. It is also intended to extend the chemotherapy services available on the site. In September 2015, Redditch and Bromsgrove Clinical Commissioning Group asked local GPs not to refer patients to Worcestershire Acute Hospitals NHS Trust over the next 3 months because the Trust was unable to treat patients within 18 weeks of referral. Waiting times were out of control in ear, nose and throat, trauma and orthopedics, gynecology, general surgery and dermatology. 2,347 patients had waited more than 18 weeks. It was decided in July 2017 to move all hospital births, inpatients, children's services and emergency surgery across the county to Worcestershire Royal. A lot of planned orthopedic surgery will be moved from Worcestershire Royal to Redditch and some day case and short-stay surgery moved to Kidderminster Hospital. Healthwatch Worcestershire, an organisation set up under the Health and Social Care Act 2012 to act as a voice for patients, carried out a survey of the use of the Alexandra Hospital in Redditch. They found that 31,613 people had attended the hospital's A&E department between April and December 2014, up 4.3% on the previous 12 months, with nearly a fifth of those coming from areas outside of Worcestershire, including South Birmingham, who were using the service as an alternative to the Queen Elizabeth Hospital, Birmingham. See also Category Health in Worcestershire. Healthwatch Worcestershire, Redditch and Bromsgrove Clinical Commissioning Group, Wyre Forest Clinical Commissioning Group, South Worcestershire Clinical Commissioning Group.